True about heparin. It's a vitamin A antagonist given parenterally, acts by inhibiting factor 8, crosses blood-brain barrier. So we have to know few things or major about heparin. Heparin is a medical mucopolysaccharide mainly. It is mucopolysaccharide that you have to know. It's a basic mucopolysaccharide. It's a non-uniform mixture of straight chain mucopolysaccharide. Okay, it carries strong electronegative charges and it's the strongest organic acid that all of you have to know. It's a strongest organic acid present in the body. Okay, it occurs in mast cells. Okay, so it is present. This heparin is universally present in all tissues containing mast cells, majorly focused in your lung, liver and intestine, these three. Okay, so what are the actions of this heparin? Heparin is a powerful anticoagulant that everyone have to know. It is effective in vivo and in vitro also. Okay, it is effective in vivo and in vitro also. Okay, so this acts by activating the plasma antithrombin, basically antithrombin 3. This heparin antithrombin 3 complex, okay, this binds to the clotting factors. It binds to the clotting factors majorly your 10, 10A, 2A. Please note all these clotting factors: 2A, 9A, 11A and 12A and 13A. So these are some common factors of extrinsic and common pathway, intrinsic and the common pathway. And this heparin, this complex, this antithrombin heparin complex will inactivate. Okay, it will inactivate them. But one thing that you have to know here is it will not inactivate 7A, which is a part of extrinsic complex. So one thing that you have to know is heparin has major role in the intrinsic complex, intrinsic pathway, and not in the extrinsic pathway. So at low concentrations of heparin, the factor 10A mediated conversion of prothrombin through thrombin is severely affected. Okay, so mainly this heparin acts on 10A and the mainly this acts on the intrinsic pathway. Okay, so one thing that you have to know about heparin, they are available in different concentrations. Okay, so this heparin, what it does is, you have to know few things about antithrombin 3 also. Antithrombin 3 itself is a substrate for your protease clotting factors. Okay, so it forms a complex with heparin. So this heparin enhances the action of antithrombin in two ways. Okay, one is this heparin. I'm telling about the interaction of this complex. Okay, first role of heparin is this long heparin. It provides a scaffold. Okay, it provides a scaffold for the clotting factors, mainly 10A and 2A, as well as your antithrombin 3 to get bound and interact with each other. Okay, it acts as a scaffold. Second point is it induces a conformational change in A3, in antithrombin C. Say if you have an antithrombin complex like this is a small example only, don't take it like I'm just telling you. Okay, this is antithrombin 3 complex. This heparin, it induces a conformational change. It will not change the structure of the molecule. It will just change the conformation of that molecule. Okay, so it induces conformational change in this antithrombin 3 complex to expose its interactive site. So it exposes all these sites. Okay, and it binds to this antithrombin 3 with high affinity to induce the conformational change. Okay, so this inhibition of your clotting factor 2A requires both the mechanism, that is your scaffolding and conformational change. Okay, so this is the reason why your heparin is insufficient to provide a long scaffolding 10E. So that's why we have various other modifications like your low molecular weight heparin, unfractionated heparin. That's why I have told these two reasons. Okay. So apart from this anticoagulant action, it has antiplatelet action also, because in higher doses it will inhibit your platelet aggregation. And your third use is going to be lipemic clearing. Okay, so it releases a lipoprotein lipase from the vessel wall. It hydrolyzes the triglycerides, mainly triglycerides and chylomicrons, to free fatty acids. Okay, that's why these three uses. So apart from this, what you have to know? You have to know the pharmacokinetics of heparin. What is the pharmacokinetics of heparin? I told it's a large ionized organic acid, so it is not absorbed orally. That's the truth. So it has to be given either by subcutaneous or IV route. Okay. So after that, what you have to know? Your T half about heparin. This T half is around 1 hour of for heparin. Okay, you have many forms like unfractionated heparin and low molecular. LMW stands for low molecular weight heparins. So what is the dosage of heparin that you have to recommend? Usually this 10,000 to 20,000 units of heparin is what for 8 hours is what we administer in a span of 8 hours. So the one problem that we are having with heparin is it induces the hematoma formation. So we have to be very careful with this. Coming to the adverse effect is mainly going to be bleeding due to overdose. So hematuria is the first sign. So your first sign would be hematuria, and the next complication would be thrombocytopenia. Okay, then reversible alopecia, but this is very rare, less than 1% of the patients. So okay, now we have seen the adverse effects. Coming to the contraindications, you should not administer in case of bleeding disorder patients, severe hypertension, then endocarditis patients, then patients who are undergoing surgery like neurosurgery, lumbar puncture and all. What is this unfractionated heparin and lower molecular weight heparin? Low molecular weight heparins, they are nothing but they have been fractionated into low molecular weight. I told you heparin has a weight of around 50,000, right? So this low molecular weight have something around 3,000 to 7,000 by different techniques. It is nothing but they act only, they induce only the conformational change in the thrombin 3 complex, and not by producing the scaffold. I told you two mechanisms right here. So this low molecular weight heparin acts only by this, whereas the unfractionated heparin acts by both of it ways. So what is the other thing that you have to know about MCQ is, what is the heparin antagonist? We administer something called protamine sulfate. Okay, this is used to reverse the heparin toxicity. As such, heparin is not toxic. Okay, the heparin is just overdose of heparin. This itself, this protamine sulfate is administered. So coming back to the question, what is true about heparin? It is not. It is vitamin K antagonist. So this is false. It's given parenterally, yes, because it's the highest organic acid. It is not absorbed orally. It is given subcutaneous and IV. It acts by inhibiting factor 8. No, it facilitates antithrombin 3. It crosses blood-brain barrier. No, it doesn't cause blood-brain barrier. Warfarin causes your blood-brain barrier. Okay. So, second option is the right answer.